Today's topic is migraine and headache. What is migraine? Migraine is a chronic neurological disorder that involves recurrent episodes of severe pain in the head. This pain often occurs on one side of the head and is typically accompanied by symptoms such as nausea, vomiting, and sensitivity to light and sound. According to modern medicine, the cause of migraine is a chemical imbalance in the brain known as neuromuscular dysfunction, such as an imbalance of serotonin in the brain. It can also be due to genetic factors, meaning a family history of migraine. Other possible causes include hormonal imbalance, such as during menstruation, pregnancy, or menopause in women. Dietary triggers like chocolate, cheese, caffeine, and alcohol. Lifestyle factors such as stress, lack of sleep, fasting, dehydration, or overuse of painkillers. Environmental triggers like bright lights, loud sounds, or strong smells. All these factors can contribute to the occurrence of migraines. The common symptoms of migraine include throbbing and pulsating pain on one side or both sides of the head. Another symptom is aura. Some people experience flashes of light or flickering in front of their eyes before the headache starts. Aura means the appearance of light before the eyes. Nausea, vomiting, and sensitivity to light and sound, which is referred to as photophobia or phonophobia. Other symptoms include fatigue, dizziness, confusion, and brain fog. In some cases, there may be numbness or tingling in the hands and feet. According to traditional Chinese medicine, TCM, migraine is not just a headache. It is associated with disturbances in the flow of qi and blood, and an imbalance of yin and yang. This imbalance is most commonly observed in the liver and gallbladder organs. As per TCM, there are certain causes and types of migraines. One such cause is excess liver yang. In this condition, there is stagnation of liver qi. Initially, liver qi becomes stagnant. This stagnation leads to the generation of liver fire, which further produces excess wind in the liver. This fire inside the liver increases the internal wind, worsening the condition. The cause is said to be excessive stress, anger, or anxiety. The symptoms may include sharp throbbing pain on the side of the head, irritability, redness in the eyes, bitterness in the mouth, red tongue with a slight yellow coating, superficial and rapid pulse. This pattern is known as liver heat rising upward. The acupuncture treatment involves sedating the following points: liver 2, liver 3, gallbladder 13, gallbladder 20, urinary bladder 18, urinary bladder 19. Tonifying the following points: liver 8, lung 5. Additional point: stomach 8. This point helps in reducing liver heat and wind in the brain and is beneficial for migraine relief. These are the common points for the above condition. The second condition is liver wind, internal wind rising. This is also caused by long-standing liver imbalance. Symptoms may include dizziness along with headache, numbness, visual aura, light flashes before the migraine. Tongue may appear pale or slightly red, wiry pulse. The common treatment points are the same as before. Sedate. Liver 2, liver 3, gallbladder 13, gallbladder 20, urinary bladder 18, urinary bladder 19. Tonify. Liver 8, lung 5. Sedate additionally. Stomach 8. If there is wind fire obstruction in the collaterals of the brain, meaning the liver fire is obstructing the brain collaterals, we add the following points. Sedate. Gallbladder 16. Gallbladder 4. Triple warmer 5, SJ5. Another cause of migraine could be blood stagnation. It can occur due to injury or emotional stress, leading to stagnation converting into qi and blood stasis. Symptoms: sharp, stabbing pain localized in one area that worsens at night. Purple and spotted patches on the tongue. Choppy pulse. Treatment: when migraine is due to blood stasis, we modify the protocol of liver heat rising upwards by adding spleen 6 and spleen 8. Points to sedate: liver 2, liver 3, gallbladder 13, gallbladder 20, urinary bladder 18, urinary bladder 19, stomach 8, spleen 6, spleen 10. Points to tone: liver 8, lung 5. If the migraine is due to dampness, the cause might be weak digestion or a greasy diet. This is associated with a weak spleen and poor digestion. Symptoms: heaviness in the head, sensation of vomiting, foggy feeling, chest heaviness, Thick white coating on a swollen tongue. Slippery pearls. Treatment: when migraine is due to phlegm obstruction, add the following to the liver heat rising protocol. Urinary bladder 21. REN 12. Stomach 40. Pericardium 6. Pericardium 7, to be sedated. In addition to these, deficiency of QI and blood can also be a cause. Causes: weakness, poor nutrition, chronic illness, overthinking, poor diet. Symptoms: mild but persistent headache, fatigue, blurred vision, pale face, palpitations, pale tongue, slow and weak pulse. Treatment: for heart blood deficiency, tone the following points. Heart 7, pericardium 6, REN 4, REN 14, REN 15, urinary bladder 17, urinary bladder 20. So what did I explain? I created a TCM, traditional Chinese medicine, diagnosis differentiation chart here. The first possible cause: liver yang rising. There will be throbbing pain, red eyes, irritability. Tongue will be red with yellow coating. Pulse will be wiry and rapid. Due to liver wind, there will be flashes of light in front of the eyes. Dizziness and numbness. Tongue will appear red and pale. Pulse will be wiry. Due to blood deficiency, there will be dull pain, fatigue, pale complexion. Tongue will be pale. Pulse will be weak and thin. Due to blood stasis, there will be sharp, stabbing pain. Pain will be in a fixed location. Lips will be purple. Tongue will be dark and purple. Pulse will be choppy. Due to phlegm damp, the head will feel heavy. Nausea. Foggy mind. Tongue will be greasy and swollen. Pulse will be slippery. Special notes: migraine is a complex condition, but with careful symptom differentiation and proper selection of treatment points, significant relief can be achieved in most cases. If we correctly select the appropriate acupuncture points, we get good results in most cases. When treatment is focused on the principal points, about 50% of migraine cases report satisfactory relief and recovery. In fact, the points we suggested first for upward heat rising, in 50% of cases, that alone gives relief. These are our primary points. Furthermore, incorporating supplementary points alongside the principal ones, based on syndrome differentiation, leads to even better outcomes in migraine treatment. Meaning, when we add supplementary points as per the symptom differentiation, we get even better results. Another treatment protocol. Tonify triple warmer 5. Sedate gall bladder 41. Sedate liver 2 and liver 3. These points also give very good results in migraine pain. Diet and lifestyle advice. Avoid greasy, fried, cold foods and alcohol. Try to maintain a regular sleep and meal routine. Manage stress. Practice meditation, TAG QI, and yogic exercises. These will help provide relief from migraine pain. Thank you, friends.